Hi, Dr. Ben here. Let me ask you this. What do you think is the biggest and most common mistake I see patients make while they're in treatment here? In fact, it's a mistake that consistently leads to poor results, frustration, more out-of-pocket costs, and really more pain for them. Any ideas? Want to find out? Great, stick with me. So here's one thing I know about you, and it's true because it's true about me. It's probably true about all of us. When I'm in pain, I want to get out of pain as quickly as possible. I think that's a safe assumption for most people. The problem, though, is like that urgency is good. Like when something hurts, you shouldn't ignore it. Ignoring it is one of the worst things you can do. And we'll probably make a whole different video on that. But when you take action because of that urgency, that's good. But the mistake I see time and time again, over the last 10 years, I mean, shoot, I don't know, hundreds of, probably thousands of times, to be honest, is when that urgency turns to impatience and people stop their treatment and they go out searching for any type of intervention that's going to give them the relief they're looking for as quickly as possible. And they do this at their own peril. And what I mean by that is that after you have an injury with your neuromusculoskeletal system, your nerves, your muscles, and joints, there is a well-established scientific health science facts that your body goes through in order to heal properly. And if this process isn't supported and honored the way that it needs to be, you'll find yourself having recurring problems as the body continues to break down faster than it should through the rest of your life. That's the reality of it. And so what I want to share with you is the healing process. And I hope this motivates you to give your body the time it needs in order to heal. But here's what it looks like on a chart. It's split up into 3 phases. Phase 1 being what we call the inflammatory phase. Now, inflammatory because there's a release of inflammation, and inflammation is the root cause of pain. All right, so when you're injured, and to be clear, an injury can be anything like one big injury, like a car accident, or you're shoveling and you throw out your back. Okay, that's one big injury. Or it could be 10,000 micro injuries. Like let's say you have a seated workstation. Maybe your workstation isn't seated and you do repetitive bending all day. That can turn into micro injuries if you're not careful. Either way, once the tissues give out, first thing that happens is that they get inflamed. Now, inflammation gets a bad rap because it hurts, but it's actually healthy because it increases blood flow into the area. The problem is that increase of blood flow can cause things like swelling and sensitivity and pain, but it also forces you to be careful on what you're doing so that you don't re-injure the site worse and lead it to a bigger problem. Now, depending on the kind of injury, this inflammatory phase will last anywhere from 3 days up to 12 weeks. That's a pretty big scale. 12 weeks, that's 90 days that your body might be caught into a inflammatory process. Now, the difference usually is that when it's 3 days or less, it's a small injury on an otherwise healthy region. Like let's say you have a perfect ankle and then you slip off a curb and you strain one of your ligaments. It's probably going to feel better after a few days. For this 90-day period, let's say you have a chronic degenerative condition of your low back and then you throw out one of the discs in your low back. You see, because the underlying condition had already been degraded and you injure it, it has a greatly delayed healing process. Now, after you get through that inflammatory phase, your body goes into phase 2, which I like to call the repair phase. And this is basically when all the tissues begin to actually heal. So if you imagine healthy tissues look like this. There's all these fibers, and then you tear them, okay? The first thing that happens is that the body lays down fibers in a random, disorganized pattern. Now it does that in order to just cover the injury. In fact, imagine if you have a cut on your hand. Initially, after the initial bleed, you'll see a light scab begin to form. It doesn't look like anything like skin should look, but at least it's not open to the world anymore. That's the repair process. Now over time, these new fibers become mature and they become organized along lines of stress, and they eventually remodel into strong tissue. Now this repair process can take anywhere from 1 to 6 months, at least. And that's not even the final phase. The final phase is what I like to call the stabilization phase. That's where the new fibers become increasingly mature, meaning that they can handle stresses, and not just normal activities of life, but more high-grade stresses. This final stabilization phase, where everything really becomes reorganized properly in its healthiest way, is anywhere from 9 to 12 months. That's, this is why, consider someone who has shoulder surgery, let's say. After a few months, they start to feel better, but any surgeon will say, hey, your shoulder really isn't going to be as close to normal till at least a year. Now, when you and I sat down, I probably told you what your approximate time frame that you're looking at is. Because worst case scenario for some people, this could take 2 years or more to get them to heal fully. Other people, best case scenario, maybe just 3 to 4 weeks. Okay, it just depends on what kind of injury there is with that. Now, the last thing I just want to bring up, because this is where I see people kind of fall into the pits of the healing process, is that once they get through this inflammatory phase and they begin to feel better, this is usually where people stop. They stop their care. Here's the problem, is that because their body isn't supported properly and fully through the entire healing process, eventually their healing momentum will begin to plateau, and then it'll begin to regress. Now, that's mistake number one. Mistake number two is that most people believe that when it regresses and they get re-injured, they're back here. That's not the case. This is what happens. Here we are, here's that healing process. They get injured, they don't fully repair, it regresses, they get injured again, they don't fully repair, it regresses, healing again, they don't fully repair, regresses. So you see, there's episodes keep occurring, but the condition of the spine or the knee or the hip or the shoulder, whatever the injury site is, the underlying condition progressively worsens. And so what does this turn into? They say, well, doc, the last time I was in it didn't last as long as this time. Well, what do I need to be doing differently, or what do I need to be doing differently? It's like, well, maybe there's some other things we can do, but the problem is that we didn't get it fixed the first time. And so in the long run, these episodes keep getting worse and worse and worse, eventually can lead into something more intense or invasive as far as treatment is considered. You start leaving the world of conservative physical care, chiropractic exercises, massage work, all those things, and you start getting more into the world of pain management and invasive procedures and injections and maybe surgeries down the road. In my opinion, completely avoidable. But we got to support the body through its entire healing process in order to do that. I hope you get some value from this video. If you have any questions, feel free to bring them up to me at your next visit.